Here's a CT of the abdomen and pelvis that was performed in a patient with a history of leiomyosarcoma. And we can see here in the inferior pole of the left kidney the enhancing tissue of the cortex. However, there's this lesion here that we see in the inferior pole that is difficult to characterize. And part of the reason it's difficult to characterize is because it's so small. If we put a region of interest over the area here and we try to get it to move so that it's right over the center of the lesion itself here, and you want it to take up about 2/3 of the size of the renal lesion itself. You can see that the density here is 49 Hounsfield units, and so anything above 30 Hounsfield units becomes concerning for something that's solidly enhancing. However, when it gets this small, one can understand that there's beam hardening artifact from the contrast here, and it becomes unreliable to necessarily, when something is sub-centimeter, to be able to assess whether something really is high density because it's a solid renal mass, or it's high density just because of either beam hardening artifact or just because it's so small that you're getting some of the surrounding renal parenchyma. And so these are oftentimes referred to as too small to characterize lesions, or TSTC lesions, with the idea that if it were bigger, we would be able to be more confident in its assessment. These almost always end up being little renal cysts, either simple renal cysts or proteinaceous or hemorrhagic cysts. However, this patient ended up getting a follow-up study, and we can see on the follow-up here, I'm just going to bring the base down here, and we're going to scroll down to where this lesion is. We can see that this lesion here is actually increased in size, and on the pre-contrast scan we can see that the density is around 38 Hounsfield units, but it looks quite a bit larger. It's a little bit more high density than the rest of the renal parenchyma. When we look at the corticomedullary phase here, and we put an ROI over this region here, we can see that it went up to 56 Hounsfield units, and then on the nephrographic phase here, we can put an ROI over this region here, and we can see that its density is now 94 Hounsfield units. And so anything that has more than a 20 Hounsfield unit difference between the base and its post-contrast can be assumed to be true enhancement, and that's the case in this one. So this is a solid enhancing mass. Anything 10 to 20 Hounsfield units is usually indeterminate. Contrast enhanced ultrasound can actually be a great tool in those cases, because the contrast in contrast enhanced ultrasound really depicts whether there's vascularity better than on CT and on MRI, assuming you're able to see the lesion well. And then anything less than 10 Hounsfield units is considered non-enhancing. And so this is an enhancing solid renal mass that was growing, and previously it was a too small to characterize lesion. This patient ended up having other lesions. You can actually see here in the pancreas there's this enhancing lesion here within the pancreatic uncinate process, and this patient had metastatic leiomyosarcoma. So not all TSTC lesions end up being cysts. Some of them can end up being solid renal masses.